My baby's cerebral palsy diagnosis was blamed on genetics. Is that always the case? Hello, I'm Marcus Boston, and I am a childbirth injury and medical malpractice attorney practicing law in the state of Maryland, and I would like to quickly talk with you today about some really important information, and that information deals with areas of analysis when we are talking about a baby who has suffered a brain injury at birth, and now that child has a subsequent diagnosis of cerebral palsy. One area or one crucial area that your attorney is going to take a look at when a call comes in like this, or when you're analyzing this type of case, is the fetal heart monitor, or the strips. And the strips from the fetal heart monitor are really important because they are measuring a lot of things, but one critical area of analysis when the strips are going is the baby's heart rate. And for a normal child, what you can see is a heart rate anywhere from between 120 to about 160 beats per minute. So you're going to be looking at the strips. You're going to be looking at them closely. You're going to be looking to see was tachycardia present. You're going to be looking to see was bradycardia present. You're going to be looking to see the variability. Were there accelerations? Were there late decelerations? Was there minimal variability? All of these things and more are going to be really looked at when you're talking about analyzing a birth injury case. In addition to that, you're going to look at some of the facts that surrounded the delivery. Was the baby blue in color? Did the baby have to be rushed to the NICU? Did the baby have to be resuscitated? All of these things are going to play a role into the analysis of a birth injury case. Add to that, what were the child's APGAR scores? Now, I say all of these things because in some instances, medical providers or doctors will say that the baby's cerebral palsy diagnosis was due to genetics. And I've been around cases in which that was said, and when we have reviewed everything, we've had a geneticist to take a look at things, a placental pathologist to look at things, or an infectious disease specialist to look at things, and when they come back and give reports and give opinions, what we find out is that in some instances, genetics had nothing to do with the child's birth injury or brain injury. What the issue was is that the doctors failed to take action. They failed to notice that the child was in distress, or that the baby was not tolerating the vaginal delivery well, and the doctors failed to move on an emergency C-section. And if they would have moved on that emergency C-section, the baby would not have suffered a brain injury. So why have I taken the time today to talk with you about some really important information? Because you could be in this situation. You could be watching this video because a doctor has told you that your child's brain injury was due to genetics. And maybe you've had another doctor to take a look at some things, and that second opinion doctor is saying something different. Maybe that second opinion doctor is now telling you that your child's injury was due to birth trauma. It had nothing to do with genetics. If you're in this type of situation, or you would just like to speak with me further about what happened in your baby's case, this is what I invite you to do. And remember, taking this next action costs you absolutely nothing. And what is that action? To pick up the phone and give me a call. I can be reached at 301-850-4832. Or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland childbirth injury and wrongful death and medical malpractice questions just like yours all the time. And I will be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group LLC, and we will see you next time. Take care and enjoy the rest of your day.